Okay, so today what we're going to get into is actually how we regulate the U.S. health insurance industry. Let's start off with a quick acknowledgement. The healthcare system in the United States is broken and has been very much broken for quite some time. Back in 2010, the United States passed what was called the Affordable Care Act as an attempt to fix at least some of the problems. Thanks to some weirdness in how laws actually work, the Affordable Care Act only really came into effect in 2012, and really there were some other things that came into effect as late as 2015. If we look at data from the US Census Bureau from 2010 to 2012, what we'll find is that approximately 48 million people in the United States were living without health insurance. This is roughly 15% of the entire population. According to a different study by the Commonwealth Fund, there were 84 million people who were either uninsured or underinsured during 2011 and 2012. In this context, underinsured means people who spend a significant amount of their income on medical care and are paying primarily out of pocket. These are also the people who are most likely to skip doses or not fill prescriptions for chronic conditions. This is problematic because, for one, it's going to increase the cost of their medical bills, and two, it makes it even harder for them to eventually get insurance should they ever get to a position in their life where they could afford it. So who are these people? If we look back at media reporting at the time, it would seem that the people who are uninsured or underinsured were mostly the elderly who were looking for help with prescription drug costs. Looking at the data from the US Census, however, we can see very clearly that only 1.7% of people 65 and older during this time period did not have adequate insurance. In fact, nearly half of all people uninsured in 2011 and 2012 were people under the age of 25. If we look at all people under the age of 35, that would represent 70% of the uninsured population. If we go up to 45 years old, we're now suddenly talking about 87% of all of the uninsured people. To phrase this another way, the number of people who were uninsured at the time and are likely to need the insurance, which would be people over 45, was about 6.4 million people, or roughly 2% of the US population. Now, I should be very clear here. I do not mean to trivialize the plights of these people or any people. Having expensive medical bills is not fun, no matter who you are or what they're for. Further, the COVID-19 pandemic exposed many shortcomings in the US healthcare system and in healthcare systems all around the world. So what we need to do is we need to identify the problems that we face so that we can have a better solution.